I am Dr. Tara Nichols, and I am the head administrator and program director for the RN to BSN program, and I'm the instructor for this class. This is the welcome video for Nursing 460 Teaching in Healthcare. If you've made it to this point, you are now entering into your practicum courses. You have completed a background check and you have obtained permission from your work organization or an organization to do your practicum experience. For all clinical practicums, you must have an RN with at least a bachelor's degree supervising this clinical experience. It will be important that there is open and consistent communication between you, myself, and your preceptor. So I'm going to talk about some things that you need to get done by next Wednesday. So it's been a journey getting to this point, and I've done everything to try to prepare people. And some of you have had a long journey, so congratulations in getting here. This class is really about applying all the things that you have been learning, evidence-based practice, putting together presentations, and so forth. Each week you have an assignment that has to be completed, and we'll talk a little bit more about that as I go through this welcome. So welcome to the course. So again, I'm Dr. Tara Nichols, and I want to give you a little bit of my background. I am an actively practicing nurse. I'm an advanced registered nurse. I specialize in pain management. I have my doctorate in nursing from the University of Minnesota and my master's and bachelor's in nursing from the University of Michigan. However, the most importantly, I am an RN to BSN graduate, and I received my associate degree from nursing from Highland Park Community College. I know the challenge and strengths of being an RN to BSN student. The other faculty advisors and I will be here to support you every step of the way. One of the benefits of Waldorf University RN to BSN program is that it is a small program, and I am a very hands-on administrator and program director for the program. I have probably talked to most of you at some point in time. The downside to it being a small program is I really have to navigate the courses to try to get you all to getting the maximum students in each class, so we don't have classes with just a few students. That being said, this course begins the practicum experience. There's 10 courses in this program, and 2 have observations, but the last 3 courses have practicums, and because of Iowa law, it is required that you have permission from whatever organization you're going to be doing your practicum, and it is required that you have a RN with at least a bachelor's degree supervising you in the clinical space, and then I am the faculty that will be supervising you for this course. I also am published. I do research with veterans with chronic pain, and I have a wealth of expertise at your disposal. So please use me. Hope you will enjoy this class. This course is intended to build on skills you already have and to expand application of those skills into teaching in healthcare. Teaching in healthcare can be something that you probably have already done or will be doing soon, which is precepting. Then you may move on to developing presentations, and always we provide patients with education. A lot of times you're having to educate other healthcare professionals and providers. So, teaching in healthcare is a really big topic. And so, this class is going to provide you with the knowledge, the skills, and the attitude that's necessary for you to be functioning at a baccalaureate level. I hope it also um, helps you in your current role and you'll be able to apply the things right away in the clinical setting. So I also expect that you will use the resources available to you for your scholarly writing assignments. Up until this point, I've been very lenient on grading people's writing. But for these practicum courses, you will do a lot of writing. It is expected that the writing will be in APA format. There is APA resources through the library. There is a nursing page that has APA resources, I believe, on the course site. You have APA resources, so please use these. If not, you can buy APA 7 book, but we do have resources, and I typically will provide people with an APA paper, an example that keys in a lot of things, mostly everything that you would need to write a scholarly paper. And so most of the time, people are losing points simply because they just didn't follow the directions. So that is a huge expectation in this course, and I will not be giving a lot of redos because I find that people don't really read the directions and they don't follow the feedback. And so your job is to make time to meet with me before a paper is due so that you are clear on what my expectations are. On the screen, you see a document that's called the Practicum Learning Contract. This document must be completed by you and me and your preceptor. You have until next Wednesday. If you need until next Friday, I can go to next Friday. But it's important that we have a clear understanding, you, me, and your preceptor, on what is expected of you. So, you're going to come up with objectives based on the topic of the class, and then you're going to fill in the first 4 to 5 weeks, what tasks you want to do, and any comments that your preceptor may have. Maybe there's meetings you want to attend. Maybe there's an educator meeting. Maybe there are different things that only happen in a certain cycle. So you need to be getting those things on your list so that you're prepared. Then you're going to use Benner's Novice to Expert. You can just Google it and you're going to say, based on the learning outcome, the course learning outcome, for this course, you can go to the syllabus and you'll see those. What is your competency level? Are you a novice in that information? Are you beginner? Are you proficient? Are you competent? And then what activities do you think you want to be included in or need assistance from your preceptor that's going to help you move this needle? So if you say, I'm a beginner, where do you want to go? Like, you can put in his comments at the end of this course, I'd like to be competent in this area. And then these are the activities I'm going to do to help me get there. I need to go over this first with you as you fill it in. Then we'll send it to your preceptor and they will look at it and add different things. Maybe there's meetings and things that they know that you don't know. You have to sign it. I have to sign it and your preceptor have to sign it because this is going to cover your first 5 weeks. What I do not want to happen is you get to week 5 and go, I didn't know what I was supposed to be doing. Your clinical time is not conducted during your work hours. So you have to make time to go and meet with your preceptor and do your project non-work hours. Caution, I have been known to show up in clinical areas. and it doesn't matter where you live. I can get on a plane and I can come and I can show up at your clinical area. So please don't try to fake this and just get somebody to sign off on your work, because I'm going to know. You need to have your preceptor. You need to introduce your preceptor to me by email. You need to have your preceptor send me their resume, and then I will be sending them the practicum guidelines for Waldorf University, and I will be letting them know that you're going to be meeting with them to complete this document after you and I go over it. So please text or email your availability. Wednesdays is by far my most available day because I have no meetings, and I usually leave that open so that people know on Wednesdays you can make appointments with me. Now, I can make appointments other days, but Wednesday is my most available day. So those are just some of the expectations. Again, one last thing, life happens. Many of you are working 12-hour shifts, multiple days, overtime. You have family and other responsibilities. Do not wait until an assignment is due to get help. And if you're starting to feel overwhelmed, don't drop the class. Contact me. Let's talk about it. And let's figure out how we can adjust some of the assignments to get you through. Okay, next slide. So my final thoughts, I will leave you with the advice I would give my own son about academic work. Do your best. Please do not wait to the last minute and just put anything together and send it to me, because I will know. Ask for help often and soon. But most importantly, have some fun. Nursing is both a science and an art, so be creative and dig deep. Don't wait until the last minute to review requirements for assignments. Review them ahead of time so you can ask questions if directions are unclear. If you feel like you are getting behind, reach out as soon as possible so we can make a plan for your success. Also, you must complete the practicum agreement. It's between me, you, and your preceptor about where you are. And you have to work. First, you start with me, then you take it to your preceptor, and we all agree on your first 4 weeks. Because what I don't want to happen is you to get to week 5 and not have a clue of what you're supposed to be doing. So we complete the practicum agreement. So you work with me on what are your objectives, what you're going to try to achieve. You take it to your preceptor. They look at it. They make any suggestions like meetings you might attend or activities you might do, and we all sign it. And I would like to have that done by the middle of next week so that by the time you get to week 4 and 5, I don't want people saying to me, oh, I don't know what I'm doing. Please look at all of those requirements, and I'm going to be sending out a document to everyone to say, I need you to get this signed, and I need to have communication with your preceptor because they need to get a copy of the preceptor guidelines, and I need to get their resume. So I know I've been giving you a lot of things you need to do, but it's really important that we get all these things done so that everybody is on the same page and you can have a successful semester. This is how you may contact me. Just like you have a life, so do I. And I can't be available to respond to you on a moment's notice or at 2 a.m. in the morning, but I am very responsive. My cell phone number is 734-646-0315. If you've reached out to me by email or you've texted me and I have not responded back to you, go ahead and call me. But email first, then text, then call. Okay? I am available to meet with you most Tuesdays or Wednesdays between 10 a.m. and 6 p.m. If those times doesn't work for you, then reach out to me by text and we'll set up an appointment. And most people who have set up an appointment with me have gotten back with me quite quickly. Okay, so I'm here to support you, and